Hello there. Welcome to my channel. My name is Gina Chumesi. I'm a psychic PRN and I upload monthly videos on mental health, self-improvement, and self-development. If this is your first time joining my channel, I say thank you so much for joining. If you're a returning listener, I will say also thank you. Thank you for supporting my channel. Please subscribe and hit the notification button so that anytime I upload a video, you'll be notified so you don't miss it. Thank you for continuing to support me and support what I do. So today we are going to talk about medications for treating depression. And my second video will be on medication to treat anxiety. But it's going to be medications that are mostly over the counter, which has shown with studies that they are very effective as well for treating mild to moderate depression, but not severe, would not be effective. And some of this medication I'm going to talk about can be used alongside prescribed medications to boost the effect of the prescribed medication to make it more effective. For depression, the first one that I'll mention is 5-HTP. HTP. HTP is a neurotransmitter like serotonin, but it's a chemical pathway to the serotonin. Serotonin is a chemical in the brain that helps improve mood and improve depression or depressive symptoms. So we call it serotonin-like. So that need to be taken 3 to 4 times a day for it to be effective. One of the big side effects that make people not take it really is the need for you to take it 3 to 4 times in a day. That's a lot for someone to just, after a while to not forget to take it. And then it will make it effective. And then the other thing is when you start it, it can really make you feel nauseous or even, make you feel like you're throwing up. So that's sometimes a reason why a lot of people don't like it. The next one is L-methyl folate. A lot of prenatal vitamins have folate or folic acid in it. It's really good for mood and improvement. L-methyl folate actually would need to be prescribed by prescriber. Folate is an essential supplement or essential vitamin, so your body doesn't produce it, or your body doesn't make it, so you have to supplement it. Is that through food or by using supplements? So usually folate is found in like green leafy vegetables, eggs, and stuff like that. It's also called a building block for serotonin. So decreased level of folate in the body can lead to depression. So usually L-methyl folate is not used solely to treat depression. It has to be used in conjunction with antidepressant. And there are so many different antidepressants and classes of it. The other one that I would like to mention is Saphron Stigna. Really, studies on that is very limited. The ideal dose is 15 milligrams twice a day. Like I said, there's not a lot of studies on it. So, sometimes you can tell a lot of these medications, they are supplements, and you just got to do your research on it. And Saphron Stigna, I know, can be a little expensive. So you just got to weigh your pros and cons and where you are, in order for you to be able to get it. The next one, which is been in existence for a long time, and maybe a lot more people use it, is called SAMe. It just enhances the work of serotonin. Like I said, serotonin helps depression or decrease depression. So it enhances serotonin and epinephrine. And epinephrine is, the chemical in our brain that helps us get that kick to get going and keep going. Also has some limited studies on it. The dose on that is 200 to 300 milligrams 2 times a day. Sometimes when SAMe is taken, especially people who have underlying bipolar, it can sometimes trigger mania. So you just got to be careful to talk to your prescriber that you're taking SAMe. And if you're taking it and you start to make you feel more manic, very impulsive, really like that decreased need for sleep, talking a lot, very, very hyperverbal, pressured speech, we call it, all that stuff. I did a video differentiating between depression and bipolar with mania. So be sure to check it out and see. So if you start having those manic symptoms, certainly you need to stop taking the SAMe. And then nausea. Another one is St. John's wort. St. John's wort also has been in existence for a long time. St. John's wort is actually a herb. And it's really been shown to be very good for treating mild depression without a lot of the side effects of SAMe. And St. John's wort actually is one of the, out of the many that can be used alone, like I said, usually for treatment of mild depression. So the dose usually is 300 milligrams 3 times a day. So morning, afternoon, and evening. Yeah. So if you can remember to take it those 3 times, it's pretty effective and highly recommended, I'll say. So the other thing too is just to be careful. Sometimes to mention it to your, because some of these medications can, if you're on some medications that can interact, it's good for you to make sure you mention it to your doctor that you are taking some of these over-the-counter medications. The last one for helping and treating, boosting your mood is omega-3 fatty acids. Omega-3 is usually found in fish, a lot of fish, especially salmon. How much salmon can you eat in order to get that recommended dose of 1 to 2 milligrams a day of EPA and DHA? So when you're getting it, make sure it says EPA and DHA on it. Most important is to know that EPA levels have to be higher. And also make sure there's no mercury, like when you're getting fresh fish, make sure it's mercury free. Now, another fish is mackerel. So besides salmon, it's mackerel and some other fishes, but those are the 2 key and most common fishes you can get on the market, but just make sure it's mercury free. And if you're getting the supplements, just to make sure that that EPA level is pretty good and you get the 1 to 2 milligrams. Omega-3, it's shown to decrease inflammation in your body. Inflammation doesn't really mean like you're going through like an infectious process, like actively having a fever or not being swollen and all that stuff. Not really. There's a lot of inflammation internally in our body anyways. Also depends on what you're eating and stuff like that. Gut health, really important to decrease that inflammatory process in our bodies. So a lot of cells can be highly inflamed, depending on what we are putting into our system. So omega-3 really goes in there to decrease inflammation. We call it anti-inflammatory. And omega-6 actually causes more inflammation. And omega-6 is found in a lot of the food, processed food, and all that stuff that we eat. So it's good to balance both. We need both, but it has to be balanced. Omega-3, omega-6. You don't want to have too much omega-6, then you have more inflammation. And the more inflammation, studies has shown that the more inflammatory cells you have in your body, the more you can have more depression and feeling weighed down, and also develop some of these autoimmune conditions that like lupus and stuff like that can happen when our bodies start to recognize our own cells and start to attack it. So lupus, MS, things like that, you can have a lot of inflammation. So really, truly be mindful to add some of the supplement as part of your regimen of self-care, to just have a healthier body, and healthier body leads to healthier gut leads to healthier mind, because our minds, our brains, and our guts are so connected. And I did do a video on our food and our mind, and I'm planning on doing another version of that. So look out for it. And my focus will be a little more like on the keto diet and the Mediterranean diet, and how that impacts our mood when it comes to depression and anxiety, and how it can help us boost that. And then the other thing to look at is vitamin D. My video the other day also on depression was focused on that, because low levels of vitamin D in our bodies provoke a lot of depressive symptoms. So making sure when you do your yearly physical to make sure that your vitamin D level is normal, if not, to have it supplemented. 1,000 to 5,000 units is recommended per day. So to make sure you supplement that if you're dealing with depression and have underlying low vitamin D levels. So now a couple of things also is when it comes to anxiety management, there's a couple of other supplements that are really beneficial to mild and moderate. Now I might say that for severe depression, the treatment, the gold standard is other anxiety medications, like Buspar or gabapentin, hydroxyzine, things like that, different versions of that, without going for the benzos like Xanax and Klonopin or stuff like that. So we'll go into that a little more detail in a different video. But for severe depression, anxiety, and for severe panic attacks relating to anxiety, we use those medications to treat it. For social anxiety or performance anxiety, FDA approved for use is like propranolol. It's helpful in treating that. It's an antihypertensive to treat blood pressure, but it's been shown to be very, very effective in treating performance anxiety, like you're going to give a speech or talk in public and you really get that anxious. That is something you need to talk to your prescriber to discuss about having it on hand, so you continue to be productive, and then you have a great 2021, right? That's the goal. So chamomile is a plant and is being shown to help with anxiety and relaxation. So chamomile can come in like tea form, oil form. I love it so much, especially in aromatherapy version, like the oil, when I put it into my thing and just smells so good. And lavender is another one in terms of aromatherapy. That's really good, smells nice, but it helps generally with controlling anxiety and stress and all that. And like really getting out all that negative energy out of your space, especially if you're working from home or from the office. Just having that aromatherapy thing going on. Check Amazon. You have really good choices there to look into. So 1,100 milligrams daily dose of chamomile, if you're going for the pill form, is what's recommended. Now Kava is another one that's been really shown to help with relaxation and control anxiety, with mild anxiety, generalized anxiety. But you have to be careful if you have underlying liver issues to really stay away from it, because Kava can really trigger liver issues if you have issues with it. Or if you start it and you notice your skin change to a more like orangey or yellower tone, to make sure you tell your prescriber or your provider, your primary care doctor, about your supplements. Like I mentioned, is very important. So some of these things can be, and your doctor or your prescriber can keep an eye on that. Another one is Valerian. It's also really great. Dose is 500 to 1,200 milligrams. Also comes in oil form. Valerian is really good in helps relaxation. L-theonine is another one. It's found in a lot of green tea. So you have to look at the label. So a lot of green teas that have that, but you have to make sure you get 200 to 400 milligrams of it in a day for it to be effective. So get, especially now that the weather is so cold, getting nice warm tea in the morning, afternoon, or evening, and making sure that it has the L-theonine, like I said, chamomile or lavender, can be helpful in giving you that relaxation that you need. Now, another supplement is called GABA. GABA is really predominantly known to help decrease anxiety. GABA is a name. It has a longer name that you don't want to hear. But it has a long scientific name. But anyway, it's chemical in the brain that helps, or we call it more like inhibitory chemical that is activated in the brain. But usually GABA can be found as a supplement, but you just got to make sure you get the one that's have good potency, because sometimes the one with lower potencies are not able to cross the blood-brain barrier of our brain in order for it to even work, because the brain is very selective in the things that it allows to cross the barrier in order to help you decrease anxiety or inhibit some of those other nerves that are firing and get you more nervous. So the GABA can inhibit those nerves and coming up. So if you're taking the supplement and it's not crossing the barrier to help, you'll find that it's not effective. You continue to be anxious. But like I said, the benzos and the other medications easily cross those barriers easily. So that's why you find that when you take a benzo, or even if it's a non-benzo like Buspar, it's pretty quickly, you find that you relax quicker, you breathe easier, and it's helpful in managing your anxiety. But with everything, like I said, at different levels, and sometimes there are side effects to consider. So if you can go with some of those milder forms to treat some of the mild and moderate anxiety without solely relying on your prescribed medications, I think is effective in preventing dependency on it, and also finding different ways to manage anxiety overall in your life is helpful to have a better look for yourself, for the year, and for your productivity as a person at work, at home, and all of that. So a lot of things to develop to bring some of this stuff to your attention, so you can check it out and try it out, and leave me a comment if you have any other supplements in mind that you have used in treating or anxiety or helping you relax at home, at work, or whatnot. Leave me a comment, drop a name, share, and let's keep this movement going. Because I said, if you whip it in your mind, you can whip it everywhere else in your life. You got this. So thank you so much for listening today. I really appreciate you tuning in, and I'll catch you sometime later. Thank you so much.